I'm Dr. Jessica Dalton. I'm a small animal general practice veterinarian, and I have with me Sue Browning, and she is our wonderful account manager and really a whiz on everything operational. So we are going to dive in because I have a lot to show you today. I'm going to go ahead and grab the screen and start sharing. Okay, so this is where you are going to land on VetRec. You should be familiar with this. This is going to be um, both the mobile and the website area that you'll land on. And we are going to go over to our side and we're going to go to intake. So intake is actually in beta testing, meaning that it is still being tested out. But if you're interested in trialing it, please let us know. I want to point out this chat in the corner. Most of you guys already know about it, but you can message into us and chat with our live veterinary professionals in real time to ask questions if you don't want to put them in the chat with me and Sue, or if you're watching this at a later date. So you can see that I have my webinar demo patient is Bruno. Bruno is a fake patient. Okay, he's made up. But I have a medical record that goes along with him, and you can see that it's already flagging things. So we already know that there's stuff going on with Bruno. And you can see your original message that was attached to the email. How you set this up is that it's basically an email box. So your normal email that your clients are already emailing you to can just be basically, what's the word I'm looking for?
Forwarded.
Forwarded to this email address. So this is what it looks like. I changed to my personal, so I don't have my personal set up. This is how you would go about setting it up. It's very easy to set it up.
Oh,
Um,
Dr. Dalton, I'm sorry to interrupt. It doesn't
yeah.
look like you're sharing your screen any longer.
Oh no. Let's see here. Let me grab it again. Can you see it now?
There we go. Thank you.
Perfect. So this is the personal email. This is going to be what it looks like when you set it up. And then this is where we have our patient already in progress for us. So we have Bruno, and we are going to um, make a appointment for Bruno. So usually at the bottom, it will say create a new visit. I actually already started his visit when we were having some difficulties getting going with the technology side for the webinar. So I'm going to go to visits. We're going to create. We're going to go to visit. There we go. And we will do Bruno, create a visit. Bruno Browning. And we will create our visit. So when we have our intake and it has the button to add, which I had already done, it will pre-populate with the records recap notes. So this is a template-based summary of all of those notes that you are basically getting for your client. And if they bring in more notes the day of, that's fine. You can keep adding to it as they bring you more notes. And it is all template based because we know what a dermatologist cares about is going to be different than what a orthopedic surgeon cares about, and it's going to be different than a general practitioner. So it can be customized to basically anything that you're looking for there. We are going to go ahead and make a note for Bruno. And for Bruno, I do have a little fake script. Again, he's not real. That Sue is going to help me with. Are you ready, Sue?
Yeah, let's do it.
Perfect. So I'm going to hit add to visit. It's going to pop up with the big recording button. I'm going to make sure that I have my template that I want to use. This is just fine. And then I'm going to hit start recording. It's going to ask for consent so I can let Sue know, hey, I have my AI scribe going. It just helps me with documentation. And I wanted you to be aware. Are you okay with that?
Of course.
Perfect. We're going to consent. It was recording all throughout that. And we're going to jump right into Bruno, our French Bulldog appointment. So, hi, Sue. I am Dr. Dalton. It's really nice to meet you. And hello, Bruno. Oh my goodness, look at your handsome face. And you're such a sweet boy.
Hi, Dr. Dalton. Thank you so much for seeing him. He is a good boy. He just has a complicated tummy.
Well, that's exactly what we're going to dig into today. Before we get started, I wanted to let you know kind of what to expect. I read through Dr. Mitchell's records, and it's a real thorough packet, so I have a good handle on his history. I'm going to ask you some questions, look over Bruno, of course, and do a physical exam, and then to kind of talk about what's going on and what we'd like to do next.
That sounds great.
Perfect. And also, Sue, I just wanted to flag this now so you're not surprised. For the diagnostics I'd like to do today, this would be a drop-off appointment. So Bruno will hang out with us throughout the early afternoon, and my technician team will be helping me do some imaging and lab work, and I'll call you on the phone later today with everything we found and a pickup time.
That sounds perfect. I actually took the afternoon off just in case, so whatever you need to do is fine.
Wonderful. Well, let's start with the diarrhea because that's difficult. Bring me up to this week, and what does it look like right now?
Yeah, so he's been having 2 to 4 episodes of diarrhea per week. It's usually a really big puddle. It's kind of soft to almost liquid. With that, I don't know how to describe it. It's like the shiny mucus stuff sometimes. I've never seen any red blood in there, but he'll have a normal day or two, and then we circle right back to it.
Hmm. And the volume, is it large or smaller, straining a lot?
Yeah, it is a rather large volume. I'd say he doesn't strain. It just kind of happens. So he doesn't really seem to know when it's coming, honestly, which makes it really hard.
Yeah, that is hard. Any vomiting?
No, no vomiting at all.
Great. And how's his appetite?
His appetite is good. He still eats 2 meals, maybe a little less enthusiastic than he used to be, but he's certainly willing to eat.
Okay. And his energy level, how's that been?
Yeah, pretty much that's been good. He still likes to go for walks. He still wants to play. I do think his coat looks a little duller than it used to. And Dr. Mitchell also noted that he had lost a pound last time we saw her.
Yeah, I saw that. And just to confirm, he's still on the Royal Canin Ultimino?
He is, yeah, we're really strict with that. He gets 1 cup twice a day, nothing else, no people food, no treats, no chews. We've even been breaking up the kibble to use as training treats so that he wouldn't get anything else.
That's really impressive, Sue. Truly. I wish every owner did what you're doing diet-wise. Um, so it's the same bag, no gaps.
Right, the exact same kibble.
Okay, perfect. And what about anything else he could be getting into? Trash, anything like that, going on walks?
Nope. So he used to grab stuff on walks, but we switched to a short leash and a basket muzzle for park walks about a year ago. Our yard is fenced and we don't have any compost or anything like that. There is a cat in the house, but her litter box is gated off, so we can't get to it.
Okay, good. And so besides the kitty, any other pets or any of them sick?
Nope. The kitty is nice and healthy. She is generally just annoyed by Bruno, which is normal for her, but no other pets.
Perfect. And I see that he's current on his Simparica Trio with his last dose May 1st, correct?
Yes, he gets that first of every month. We never miss it.
Great. And has he ever traveled anywhere, especially anywhere warm, coastal, Arizona, Texas?
Yeah, we did take him to Texas for a long weekend. I think that was back in March of 2024. It was right before the very first diarrhea episode, so we kind of have wondered if that could be related.
Yeah, that could be relevant. That's something we're definitely going to keep in mind.
Oh, interesting. Good to know.
So just a quick run through of his other systems. Any coughing, sneezing, drinking habits, urination habits, itching.
Nope, everything else has been fine.
Perfect. And then one last history question. Is he on steroids or has he ever been on steroids?
No, never.
Okay, great. Well, I'm definitely going to do a physical exam on him now that we've gotten a history. Um, really informative. Let's get my hands on him.
Great.
Okay, on physical exam, Bruno is a 4-year-old male neutered French bulldog. He weighed 27.8 pounds with a great body condition score of 5 out of 9. His muscle condition is also excellent at 3 out of 3, and his temperature is 101.6. His pulse is 124. Respirations are panting. He's bright, alert, and responsive. From his physical, he generally is a healthy looking small breed dog with a thick and slightly inflamed feeling small intestine and very mild coat changes that fit the chronic enteropathy picture. Nothing at his exam is really screaming at me that we have an acute or surgical issue. All right, so this is where I'm at on exam. I found a couple of things consistent with his history. His intestines feel a little thickened and ropey. The coat is a bit dull, and everything else looks great. So now I'm even more confident that what we're dealing with is some type of chronic enteropathy.
Okay, so what does that mean for next steps?
Yeah, that's really where the drop off comes in. I'd really like to do an abdominal ultrasound and get a good look at what's going on internally in his abdomen. Um, we may have to do some sedation with that, but most dogs tolerate it just fine.
Okay, that makes sense. He's had x-rays before and he's been good for those in the past.
Right, and then I'd like to send out a full GI panel to Texas A&M. Just make sure that we're not missing anything going on there, so we have a good baseline going forward.
Okay, how long does that normally take to come back?
That one usually takes a week to 10 days. We'll get that pulled and sent off today, though.
Okay, sounds good.
And then let's not change anything about his diet until we touch base again.
Of course, perfect.
All right. Well, you're going to be spending the day with us, Bruno, and we will give you a call to go over our findings and when you can pick them up.
That's wonderful. Thank you so much, Dr. Dalton.
Thank you. All right, everybody. Thanks for bearing with us while we went through our mock patient. But I wanted to show you just in 7 minutes, we are able to basically generate an entire note. Um, while that's generating, I wanted to come back up here to kind of go over what you're seeing. So you have your overview section. So this just gives you a summary of your patient. The owner is not the owner of the pet. The owner is the owner of the visit. So that would be the doctor or the primary clinician that's on that case. Records recap again, that is where our intake is going to give us um, a recap of all of his previous medical records, so prior treatments, prior medications, all of those are going to be covered there. And easy to add to it as we know some owners will bring notes with them when they come in. So we have our notes. As you can see, it is generating it. I do want to generate a new note though, because we said that we were going to have him come in for an abdominal ultrasound or keep him for an abdominal ultrasound, and we can make templates for those. So I wanted to highlight that and show that to you guys. The awesome thing is that we can do templates not only for abdominal ultrasounds, but also for radiographs. So if you're reading a lot of radiographs, we can do templates to help you out there. For our dermatology people who are reading a lot of their own derm slides, we can also do templates for dermatology slides, ClinPath slides, for those people who love poking those masses. So let's go ahead and generate us a ultrasound report. And again, this can be specific to you. This is just one that I didn't make it, but I have on good authority that it's a good one. And then we are going to add a new audio. I am going to say, hey, so doing Bruno's abdominal ultrasound, and it is within normal limits. There is no abnormalities found, because don't we hate when that happens? For next steps, we're going to wait for that GI panel from Texas A&M, maintain his diet, and touch base with the owner. All right, and then that's going to generate a note. Here we go. So we will have both our SOAP note, and the SOAP note is just like a Word document once it's in this form. So respiratory rate, I said panting, but it only accepts numbers. We can also have it say panting for you as a default, but this one just has not mentioned. So you can delete it and add panting just like you would on any Word document. You can also download these as PDFs. You can copy and paste them, but we do integrate with most medical record systems. And if you're not sure if your integration set up or if we integrate with yours, let us know. Jump in the chat or talk to your account manager. They are more than happy to help set you up with that so that it's easy to get your medical records from your VetRec right into EasyVet or Cornerstone, whatever you're using. So we have our webinar ultrasound report. So we have all of our normal findings, interpretation, basically because I said it was normal and didn't go into details, it didn't pick that up. But then we have our recommendations and my signature. So if this all looked good, because we always want to check it over, if this all looks good, the next step is really to make the discharges or to call the client. So we're going to make the discharges while I show you the phone calling. So we have the discharge templates. Again, these can be made specifically for you. So we have different types that we can help you make. Say I want a RDVM email. And I'm going to select that one. And this is going to include everything because I want them to have a full picture of what happened at the visit. We can start generating the RDVM letter, and then we'll be able to email it off just from the platform. And then we'll be able to add discharges for the owner. But while that one is populating, say we want to give the owner a phone call. So we need to let Sue know that Bruno's ready to go home. All we have to do is hit the phone call. We have two options. We can either call via the phone, so our office desk phone or the front desk phone, and you can either have a VetRec number, which is just a randomized number, or you can set your phone numbers for your clinics. So I would recommend that. It's easy to set up. You just hit this and it will walk you through setting that up. You'll put call me at, so that'll be the phone number for the desk that you're sitting at, and then the client's number and start call. It'll call you, you'll usually hit 1, and then it goes through for the client that this is being recorded. And then as soon as you hang up, you'll have a generated note. The other option is to actually call through the website itself. So if you're sitting at your computer and maybe, or it's a computer that doesn't have a phone, but the computer has a microphone, you can call through the computer. And again, that rec number or hospital number is what the owner will see. And then you would just put in the client's number and it would start call and it would still go through the recording process for the owner. And you would be able to get a summary, a client communication summary, as soon as you're done with that. So we've called Sue. We let her know that Bruno is ready to go home. We populated our referring vet. So Dr. Mitchell is who sent this patient over, and then we're going to make a discharge for the owner. Again, you can pick what you want to include in this, and you can pick your template. So we're just going to hit discharge, and we're going to do this one, and we're going to hit generate note, and that's going to make us a second note. And then really excited to share with you guys that we have a new feature in our discharge. They're called care plans. These have been much asked about because while having this discharge is very thorough, sometimes owners just want something that they can quickly reference back to. And that's really where the care plans are coming in. So it's generating, and then I will show you what a care plan for this patient would look like. But this RDVM is ready to go as well. So we have our discharge, we have our care plan. So this breaks it down for easy access for the owner, okay? So they're able to see visit summary, what did we talk about diet, what are we watching for, and what are our next steps, and when to go to the ER or give us a call. And that's in red because that's going to be important, right? And you can either download this as a PDF to attach to your medical record. You can send this as an email, okay? Send the care plan as an email, or you can print it out and they can walk out the hospital with it. So a lot of times we'll print these and then they go on the cage card so that the technician can grab it and hand to the owner as they're walking out the door. So they make sure they get that, and then we will email them the discharge that may be a little bit longer and also attach the care plan. We can also attach the findings so that the owners have a ultrasound report and they have the physical exam report. So we can attach all of these and send them to the owner. And all you have to do is hit send to and send just like a normal email. And then same for referring vet. You're going to hit send email. It's going to populate the email for them about everything that was gone on at the visit so that everybody involved in the care plan already knows. So that's basically it in a nutshell. That's how you can do an entire visit on the VetRec platform. So from the initial email of the records that they send you to recapping those records so that you can basically see all of those previous medical records, to making a note and recording all of your treatments. And like I said, for when you're in the retreatment room, you really don't have to worry about it catching any of those side conversations. The templates are really narrow to kind of filter that stuff out and really focus on what's medically important. And then making those discharges, because we know that discharges are going to increase our owner compliance. If your owner does speak a different language, you can also change that. So if Sue was preferring the Spanish language, we could go down to change language. And we have a whole bunch of options, but we can hit Spanish and we can go ahead and regenerate that discharge to go home in Spanish to increase our owner's compliance. Is there any questions in the chat? Or Sue, did you have anything that you'd like to add?
Dr. Dalton, we do have one question in the chat. It
Excellent.
says, I missed the part of how to enter the referring vet's information. So name, hospital,
Yes.
email.
So for the referring vet's information, you don't have to enter it. It will capture it from the intake. So as long as that information is on the email that gets forwarded into this email box. So a lot of the clinics we're working with have an email that they've been using for a long time, and they've simply set it up to forward the emails into VetRec. And when you do this, you don't lose it in your original email. It's still all going to be there. It's just also going to be in VetRec. And then as soon as it comes into intake, it's going to populate all of that for you so that that's already done. Great question.
That was our only question at this point.
Okay.
But if anyone has any additional questions, please feel free to reach out through the support chat within the platform itself. One other question just came through. How do you forward email to VetRec?
Yeah, so it would be setting up this intake box. And if you're interested in intake, again, it's in beta. So I would talk to your account manager or jump in the chat if you don't know who that is, and they can get in contact with them. But they will walk you through basically setting that up. It's very simple. So you can see my personal one isn't set up. If I hit intake setup though, it's going to walk me through the process. So basically choosing the name of the inbox that we're going to be referring these to or forwarding these to. Do we want to require documents in order to forward it to the inbox? Who is going to be the default owner of that inbox? So is it going to either be, the medical director or the head CSR? For the generated records. I want it to generate a summary basically every time. You can select what type. So maybe you really want lab results. Like that's what your doctor cares about in their summary that they're getting first from these records that are coming in. You could do lab results, timelines, anything that you want to set as your setting, and then medical flags, and then create visit or create an existing visit from that intake will all be options. So very easy to set it up. You just have to kind of unlock it behind that secret flag But again, we can help you out with that.
Thank you. We currently do not have any other questions.
Well, awesome. Thank you guys for joining me. We're sorry about the technical difficulties, but like I said, we will post this and we will also send it personally to all of the attendees, especially since we were unfortunately started so late. We'll make sure that we get that sent out to you guys so you have a chance to walk through it. If you want to walk through it in deeper detail too, we're happy to do those one-on-ones, okay? We are here to help you get the most out of this platform, and you really can do a visit from the get-go all the way to the discharge and through the follow-ups. Okay. Well, thank you guys for joining us today. I hope you have a wonderful rest of your day. And if you're joining us later, you can still reach out with questions. We love that. Okay. Have a good one. Bye.
Thank you all. Bye bye.